Welcome to today's SparkMap webinar on demystifying BRFSS data with SparkMap. I'm Jordan Rhodes. I am a project coordinator with the Center for Applied Research and Engagement Systems, or CARES for short, and we are the folks behind SparkMap. So for any of you who are new faces, know that behind SparkMap is a team of programmers, data analysts, and GIS technicians working for the University of Missouri. And our primary focus as a group is data aggregation and presentation. And so we collect a lot of data from a lot of great sources, including the Places portal, which has our BRFSS data, and some of these sources you can see on the screen. And we take those data, we aggregate them, clean them up, and make them available to folks in SparkMap. So today, our Assistant Director and Data Team Lead, Angela, is going to walk us through some background info about the BRFSS Places, and then I will lead us all in a little demonstration afterwards. So Angela, I'll pass it over to you.
All right. Thank you so much, Jordan. So as Jordan said, in today's presentation, we'll be going over some background information about the CDC BRFSS Places dataset, which will include a discussion of what the Behavioral Risk Factor Surveillance System, or BRFSS, is, as well as some of the other BRFSS data products and how they compare to Places. And then I'll be, like Jordan said, handing over the reins to Jordan so she can demonstrate how to find and use the Places data in the SparkMap assessment tool and in our map room. So if you're not familiar with Places, it is the CDC's premier data set for local and timely data on health status and health-related factors, with estimates down to the census tract and zip code levels, making it this extremely useful data product for assessing health status and needs in local areas. Technically, Places stands for the Population Level Analysis and Community Estimates, but for this presentation and really out in the wild, you'll mostly see this data set referred to as Places or maybe BRFSS Places or CDC Places. So I want to give you some background about Places, but in order to describe what it is, we need to first talk about the Behavioral Risk Factor Surveillance System, or BRFSS. So BRFSS is an interview survey that was first established by the CDC, the Centers for Disease Control and Prevention, back in 1984. And it has been running continuously to this day. So this survey samples annually over 400,000 adult individuals across all 50 states and in some of the US territories as well. And it is considered the largest continuous health survey in the world. So BRFSS consists of these core questions on things like health status, so the presence or absence of disease, on health behaviors like smoking and alcohol consumption, and on preventative care practices and more. And in addition, the survey includes each year questions about maybe some emerging topics, like in recent years, experiences with COVID-19, and questions on optional topic areas like diet and nutrition, and more. And in 2023, for example, in addition to the core questions, there were over 30 optional state modules with multiple questions each. And participation in those optional modules could vary from like one or really close to all of the states. So each year, the CDC analyzes the BRFSS survey results to produce multiple data products, including the chronic disease indicators data set. So this is a data set that they release annually with state level estimates of the prevalence of different diseases by state and demographic groups. They also produce the SMART estimates, which stands for something around metropolitan area estimates. And the CDC also makes available their raw survey data for download, which can be used by analysts to create their own custom data sets. However, these data products have really historically been limited to results at the state and national levels, and for some metro areas, so those areas with like over 400 or 500 total respondents in a particular area. So that changed in, I think, 2015 for the first year when the CDC began providing a data set called, at that time, the 500 Cities Estimates. which used BRFSS, this health survey data, as the input to produce these small area estimates for a few dozen of those core metrics. And initially, 500 cities was for just the 500 most populous cities in the US. But then in 2020, the CDC expanded this program to include data for almost all census tracts and zip codes in cities and counties across the United States. And thus, PLACES was born. So with the 2024 release back in August of 2024, we now have 5 years of local neighborhood level data available for many of these core health related indicators. So these estimates for places are generated using a model based small area estimation method. Because we can't, sample every adults in every single census tract or zip code across the US. This model method involves generating predicted prevalence values, and by prevalence we mean something like the estimate of the percentage of adults who smoke, for example, in a particular zip code. So these estimates are again created using a model with inputs from the BRFSS survey itself, along with some demographic variables from other data sets, like maybe the Census Bureau's American Community Survey. And then the results from the estimation model are tested and validated against the survey results themselves for accuracy. So I don't going to go into too much more detail about the model methods today, but if you do want to know more, the CDC provides methodology information and validation information on their website. So what data are included in PLACES? Well, the latest release, so the 2024 PLACES release, includes data for 39 total measures derived from BRFSS questions across the topic areas shown on the slide here. So the majority of these come from the core BRFSS module, so those questions that every state that respondents in every state answer. The indicators in the health outcomes category include things like tracking the prevalence of conditions and diseases like heart disease or diabetes. Prevention practices indicators track cancer screening and flu vaccination. We also see data on disability status and type of disability, and on health risk behaviors like tobacco use and sleep habits. And finally, health status includes indicators like self-reported physical and mental well-being. In addition, there are 7 measures in this latest release on health-related social needs. These are derived from optional modules, though, and so they're only available for something like 30, 35, 36 states. These include measures on things like food and housing security and insecurity, and transportation access. And finally, there are 9 measures included in a PLACES dataset if you were to go to and download the full dataset that come directly from the American Community Survey estimates and describe things like social determinants of health, poverty rates, educational attainment, etc. So to summarize, the CDC's BRFSS survey data is used to create these multiple data products and data sets, including, for example, the raw survey data, which you can download and access. The BRFSS survey data allows us to view really any and all of the survey variables asked across all of the different states, of which there are over 150 in a given year. We're also able to look at population subgroups within the data. For example, we could see how something like primary care utilization varies by sex or by age group or by marital status and more. But a major limitation of most BRFSS data sets and products is that data scale or granularity. Now, PLACES is a data product based on BRFSS, and it's been available nationally since 2020. There are about 40 different core measures, and PLACES data are available for those small geographies, your census tracts and zip codes, which allows us to see that very small scale local variation in health behaviors and outcomes. But there are some limitations to PLACES. So unlike BRFSS, again, we don't see our population subgroups. And next, because they're modeled estimates, they are really just our best guess about population health. They're not a sample of every individual or even a single individual in every neighborhood or zip code. Because they're estimates, we can sometimes see strong delineations, like in the bottom left map here by states. That might indicate that the model was maybe overly reliant on the state variable to produce that estimate, but that's not something we see across all of our estimates. And then there are also some regional limitations to PLACES, which I will describe on the next slide here. So in this slide, I just want to briefly talk a little more about that BRFSS participation in those optional survey modules and data availability and coverage. So again, it's important to mention that all 50 states and the District of Columbia participate in BRFSS. However, administration of the BRFSS is handled at the state level. So that means that each state's survey process can vary. So we already shared how states can choose from the optional modules, but states can also design their own survey questions and sampling procedures. So the image on the bottom right here shows a map of all the states across the US and their collection of data on sexual orientation and gender identity during, I think, the 2022 survey year. In orange, you can see the states that used the CDC optional module. In dark gray are the states that designed their own survey question around sexual orientation and gender identity. And so sometimes these states might ask more detailed or more nuanced questions than the CDC module. And in gray are states that did not participate or did not collect any information on sexual orientation and gender identity. So you could see how, different states pursuing different optional modules might make it more difficult to analyze at the national level. But then in their administration, states can also choose to oversample or collect survey data from more residents than are strictly required by the CDC. And states can also generate their own data products. So here in Missouri, every, I think, 4 years, our state generates enough survey data through oversampling to produce what they call the Missouri county level study, which are county level health prevalence estimates, which you don't get from BRFSS outside of the PLACES data. So while the states handle the administration of the survey data and have a lot of freedom there, the CDC is ultimately responsible for aggregating back the survey data and producing some of these national data products. But they do have some strict quality assurance rules. So when you're looking at some of the data that Jordan will be demonstrating shortly, you might notice that if we look at different survey years, there may be some states with missing data. And that's in 2021 with the 2021 survey. Data for Florida were omitted from the aggregation because CDC didn't feel that they had enough samples to reliably produce estimates, and the same in 2019 for New Jersey. But in the latest survey year, so for the 2022 survey, 2024 release, there is data for all states and areas. So with that background information, I will turn things over to Jordan to show you how to find and use the BRFSS data, PLACES data in SparkMap.
All right, thanks so much, Angela. For our demo, I would like for us to kind of frame these demonstrations around a couple of different scenarios. So for scenario 1, let's say I am working with Wake County, North Carolina. And let's say that their funding for asthma control and care has recently been dissolved, which we know is one of the numerous disturbances, right, in the healthcare funding landscape right now. Let's say we're applying for new funding through some different avenues, and I'm wanting to provide some data demonstrating the need for asthma control and care in my area. And if possible, I would like to also pinpoint areas where this need is going to be the most pertinent, right? And so here are my kind of guiding questions. Is asthma a prevalent issue in Wake County, North Carolina? And if so, where in Wake County is asthma control and care most needed? So in order to answer these questions, I'm going to hop over to SparkMap. So in order to do this, I am going to have 2 options that I can choose from: the Community Needs Assessment tool and the Map Room tool. I am going to use the Map Room right now, and in our next example, we will look at that needs assessment. And so the Map Room is a completely free resource housing over 33,000 data layers from over 100 secondary sources. It is a very powerful tool, and I always like to point out that in addition to having up-to-date data, it also houses historic data. And again, to navigate to this map room, I just clicked that top Create tab and then the Map Room drop-down. And so now we are here and we have a lot of different options we can choose from. And so my first step is going to be to navigate to my geography of interest. And so I'm going to go down to this bottom right corner, and I am going to type in Wake County. I'm going to give my little pop-up a second to load because sometimes it can take a second. And then I'm going to click my geography of choice, which is Wake County, North Carolina. This search bar, you can search for counties, you can search for specific states, you can even do specific addresses, zip codes, etc. It is pretty robust. And so I have zoomed into Wake County here, and I have a very boring empty map. I'm going to zoom out just a little bit so we can kind of get a better view. And now we are going to search for our data. So we're looking for data on asthma prevalence. And so I'm going to browse by source, and it's going to think for a second. And we are going to find our BRFSS data. And then I'm going to go down here to health outcomes and chronic disease. And then we have all of our indicators related to chronic disease that are sourced from BRFSS. And here we have our asthma from 2022. And as we can see, it is from the Places project. So I'm going to click this checkbox beside asthma to add it to my map. Note that if I were looking to add, or if I were looking to see any additional information about this data set before adding it, I could click that nice I button, and it's going to give me a nice explanation of my data source and the specific data that I've added. And so I am going to get rid of that, hop over to my legend, and right now we're looking at this data at the place level, but I wanted to look at it at first at the county level. And so I'm going to click this little geography drop down here, and I am going to select county. And while it is thinking, because this layer has been a little slow for me this morning, there we go. I'm also going to manage my reference layers to make this map a little bit easier to interpret. And so I'm going to click this toggle here, and I'm going to go down to county boundaries. And as you can see, this is kind of grayed out. So I'm going to click this map button, and my county boundaries are going to appear on my map so I can more easily identify my county. I also have the option to label my counties. Though I will say sometimes the overlap of city names and county names is a little distracting, at least for me. And so I am going to unclick that label button and undo my toggle to hide that. And so now we're looking at these data at the county level, and it actually looks like Wake County is doing all right in terms of asthma prevalence, right, according to our estimate here. So I can click my county to see that we are falling into that under 9.1%. So according to our estimate, 8.8% of the adults in this county have documented asthma. However, we know that county level data is, pretty high level. Counties are big, and especially this county has a pretty high population. And so it could very well be that there are, areas of higher need in some parts of the county and areas of less need in others, and they could be sort of balancing each other out, so to speak. And so we're not seeing the full scope of the problem or the potential problem. And so in order to do this, we're going to need to look at these data at a much more granular level. And so we have the option in our geography drop down to look at these data by place, zip code, or tract. I'm going to go ahead and look at them at the census tract level. And as we can see, we have a much more granular map. So over here in the kind of west corner of the county, our estimates show that our percentages of the population with asthma are pretty low, right? But over here towards the east side, they are much higher. And so this would be an area, right, where we would want to kind of focus on allocation of funding and programming. And so like we did with that county level data, we can click any of these tracks to view more information about what we're seeing. So in this particular track, 12.9% of our population is estimated to have asthma. You can also, if we wanted to kind of take these data and get a lot more information out of them, something we can do is go over to our Map Room tools, and we can query or download these data into a CSV table. And so I am going to zoom into my map, and then I am going to do a query. And so for my query, it's basically going to allow me to ask a question of these data that I'm seeing. And so I am going to select the percentage field because I'm interested in percent of population estimated to have asthma. And then I'm going to choose greater than, and let's say my value can be 11%. So I am querying to see, which tracks on my map are estimated to have a population with over 11%, or where over 11% of our folks have asthma cases. And so I'm going to run that query by clicking the button. And as you can see, our tracks have been kind of outlined here in this little purple line. And so now I'm going to view that data, and I have a nice table of my query results that I can then export as a CSV. And so I'm going to exit that and jump us out of our map room. We will come back for a second here in a minute, and I will point you all toward some kind of support materials and resources in case you are new to our map room and need, some more robust how-tos. And so for now, I'm going to click this nice little Spark icon in the top left, and I'm going to go back home on SparkMap. So let's think about another scenario. So let's say I am working in Lawrence County, Alabama, and I'm wanting to see whether or not additional mental health care is needed in my area. And so I'm trying to demonstrate that this is a need. And in order to do this, I'm going to use the Community Needs Assessment tool this time rather than our map room. Now, with these two tools, I tend to like to use the needs assessment when I am wanting to look at a lot of data all at once. And then I like to use the map room kind of for deep dives into one or two very specific topics. You can use them however you like. I always find that this is the kind of easiest way for me. So for this example, though, I'm going to go ahead and go down to Lawrence County, which is a very rural area in North Alabama. Then I'm going to hop over to my data indicators. For any of you who are unfamiliar with this report, there are a couple things to note when we are selecting these indicators. One is that unlike the map room, there are some paid levels to this report. So if anybody is following along, your report is going to look a little bit different from mine. I am using a premium annual SparkMap report, which is our highest subscription level. So the main differences are going to be the types of locations you can select and the amount of data that you can pull into your final report. So note that BRFSS Places data is going to all be completely free in the map room, but in this reporting tool, some of them are going to be behind our kind of subscription paywall. And so to find my indicators, I am going to search for BRFSS in our search bar. And here are our BRFSS indicators that we have available in this report. And so thinking about kind of demonstrating a potential need for mental health care services, I am going to select a couple of indicators related to this. So I'm going to click feeling socially isolated, lack of social and emotional support. Let's look at heavy alcohol consumption. And then let's also look at folks who reported having poor mental health or poor physical health. Now, a couple things to note as I am clicking these buttons here. I'm clicking a check mark to add an indicator to my report. Same as in that map room, I can click an I button beside an indicator name to view a little pop-up that gives me information on my data attributes, links me to a map of my data, and links me back to my data source. So I'm going to close that out. And then I am going to click over to our report. And so this report is going to generate, no steps needed on your end. And every report, you're going to get the same basic structure. You're going to have a bold heading for each indicator you selected over in step 2. You're going to have a stem sentence or paragraph explaining the data that you've added to your report. you are going to have a table giving you data for your county or counties, your state, and the United States. We will talk about some ways to look at these at more granular geographies here in a second. And so we are also going to always link you to the map room so you can explore your data spatially. And with a lot of these data, we're also going to be providing what we call little benchmark dials that are going to show you how your location is doing when compared to your state overall. And so these benchmark dials are going to have little lines on them that are either going to be red or green, depending on whether your location that you've selected is doing better or worse than your state. And so as we can see, Lawrence County, Alabama is going to have some pretty clearly demonstrated needs here. So feeling socially isolated, our estimated percentage of folks is higher than our state, right? Same with lack of social and emotional support. We are, again, a little bit higher than our state, not doing great. Same with heavy alcohol consumption and reports of mental health status. And so, these are all, data that we can use to start to kind of build our case for justifying rollout of extended mental health services in this area. Now, we talked about looking at this at a bit more of a granular level. And so for our premium folks, we have a report option to show zip code data. So I clicked this report options button at the top of my report, and now I'm clicking show zip code data here. And this is going to give me data for each zip code within my county that I've added to my report. And so this, kind of similar to how we did in the map room, right, is going to allow us to start to get more granular, to kind of pinpoint potential areas where needs might be higher or lower, right? Another thing we can do in this report that folks can find really useful is we can create multi-county reports. So let's say, yes, we know that Lawrence County is not doing great compared to the state of Alabama as a whole, but what about compared to its neighbors? And so I know that there is a county called Winston County, Alabama, that is a neighboring county, and it is, similarly rural, similar demographic makeup. And so I'm going to add it to my report as well. And so my data indicators remain selected. I'm going to generate my report. And now my report is going to start telling a bit of a different story, right? It's going to give me data for my combined report location of these two counties. And it's going to allow me to kind of compare between the two counties and see, where one is doing significantly better than the other. And so at a local level, right, we can use this to begin to explore, what is Winston County doing that Lawrence County is not, right? What programs or resources do they have in place that are not accessible to these folks over in Lawrence? And so one other thing that I wanted to highlight here, I am going to go down to our poor mental health, and I'm going to jump us into the map room. And so something that we can do from the map room is we can add data from other sources to our map and view these alongside our BRFSS PLACES data. Let's go ahead and see if our tract level map looks a little nicer for this. I'll zoom in. Oh, we're just purple. Okay, so I am looking for mental health care providers. And so I'm just going to type in the word mental in our search bar. Note that this map room search bar, we are in the process of making some big improvements to it. Right now, we are not quite as sophisticated as, say, Google. And so if you type in a big long phrase or a question, it might tell you we don't have results when we really do. So stick to 1 or 2 word keywords. So we have our mental health providers from the Center for Medicaid Services, NPPES. And so I'm going to add that to my map here. And I am going to drag it and drop it so that it appears above my frequent mental distress map layer. And so we can start to get an idea of what our landscape of mental health care looks like in this county. And so we have two providers here that we can see. And we can even click these dots to view a pop-up that's going to, once it loads, demo effect always, it's going to give us the name of that mental health care provider and their address for their place of work and a phone number. And so for one more example, I think we should have time. I am going to take us back to that reporting tool, and we are going to look at a more custom location. So I'm going to click that Create button and Community Needs Assessment again. And let's say I am working with a group in Lincoln, Nebraska, and they have a pretty small service area of a couple of zip codes. And so in order to create the small service area, I'm going to click this Pick From Map button. And I am going to type Lincoln into my search bar here, click my correct Lincoln. And then I have a select a geographic type drop down here. And I am going to select a zip code, but as you can see, we can create these reports at a couple of different geography levels, including school districts, state house and senate districts, census tract, etc. And so we'll do zips. And I am going to click a couple of zip codes in my potential little service area here. And so I will note while I am clicking zip codes and it's zooming us around that something very nice about this pick from map feature or our multi-county selection or the draw my area tool, and I can point you towards support materials for it, is that once I have clicked all of these little areas and created my custom report area, I can save that location to my SparkMap profile. And so you don't have to come in and do the re-clicking every single time. And so with that though, I have created my location of choice and I am going to move over to my data indicators. So let's say with this group, they are seeing really high rates of late stage breast cancer and cervical cancer diagnoses. And so we are wanting to kind of do a bit of research into that, right? And so one of our first thoughts might be, are people utilizing preventative care? And so again, I'm going to search for our BRFSS layers to kind of filter this indicator list down. And I'm going to go down to our section on clinical care and prevention. And so I'm going to click on our cancer screening for mammograms and our cancer screenings for cervical cancer. And then again, I am just going to click my reports button to view my data in the report. Now, same as I did with that county level reports, I can go ahead and go up to my report options and I can choose to view these estimates at the zip code level. And so I can begin to see that, okay, there is an estimated significant portion of folks who are, not getting their mammograms. A significant percentage of folks, so the 77 and the 73 up there, those are the percent of people who are, right? But it is going to be red because it is showing that that is lower than our estimated state average. And so we can use these data, right, to begin to show that, it really looks like folks aren't utilizing these preventative services. And so this could be one of our reasons behind this large amount of diagnoses. And so again, how we did with that other map, something we can do with this is we can go into our map room again. And we can look at these data alongside other data. So for example, I could pull up our data on obstetricians and gynecologists. So let's see if I can spell today. Oh yeah. And we can see, okay, there's an estimated high percentage of folks who are not receiving this treatment. Is it an access problem, right? And so we can see that, perhaps some of it is an access problem because within these zip codes that I have selected, there is not a single OBGYN that is um, in our record here from CMS. And so again, we can kind of use this to begin to craft a story and investigate further into questions we have about our communities. Now, I am going to kind of wind us down and then open things up for questions. But before I do, there are a couple of resources that I want to point your attention to. So first and foremost, if you are new and you have not used the SparkMap Map Room or Needs Assessment before, and you are disoriented because we jumped through all of that pretty quickly, we have a really robust support library with step-by-step tutorials for all of the components of our needs assessment and our map room. And for those needs assessments, we even have nice 2-3 minute videos that you can follow along with. Another thing to note is that for our BRFSS data and all of our other data indicators, we have this nice data news page under our data dropdown where we are going to release little reports on our latest data updates. We also have nice comprehensive lists for that needs assessment and the map room that's going to just tell you all the data we've got in the tool. One other thing that I want to point out is just how you can contact us if you have any questions. And so on our homepage here, if you go down to the very bottom, we have a nice contact form here that you can fill out to reach out to us. We also, if you go to the footer and click this contact button, it will give you our email address or prompt you again to fill out that contact form.
Thank you for learning more about SparkMap. If you have any questions, feel free to reach out via the contact form on sparkmap.org. Don't forget to subscribe.